Welcome to Obstetrics and Gynecology Made Easy. In this video, we'll talk about managing dry cough during pregnancy and the safest drug options for both you and your baby. Stay tuned for practical, evidence-based advice to keep you comfortable and healthy. 1. Most safe strong evidence options, first-line treatments. These are the safest medications and remedies for dry cough during pregnancy, with strong evidence supporting their use. Non-pharmacological and demulcents, soothing agents. Honey. FDA category, not classified. Dose: 1 to 2 teaspoons, 5 to 10 milliliters of pasteurized honey up to 3 times daily. Mode of action: coats the throat, reducing irritation. Evidence: supported by ACOG, RCOG, and BNF. Recommendation: use pasteurized honey to avoid the risk of botulism spores. Glycerin. FDA category, not classified. Often found in cough syrups and lozenges combined with honey and lemon. Dose: 5 to 10 ml of syrup or 1 to 2 lozenges is needed. Mode of action: forms a protective layer over mucous membranes. Evidence: safe in moderation, avoid excessive use due to limited safety data and possible laxative effects. Marshmallow root. FDA category, not classified. Ivimune and Pro-EFU syrup both contain marshmallow root extract, thyme leaf extract, honey, ivy leaf extract and vitamin C. Dose: 5 to 10 ml syrup up to 3 times daily, or steep 1 to 2 teaspoons of dried root in hot water for 10 to 15 minutes and drink 1 to 2 cups per day. Mode of action: soothes irritated mucosa. Evidence: safe when used in moderate amounts. Herbal remedies like ivy leaf extract and thyme. Ivy leaf extract is mainly used for productive coughs but can also help with dry coughs by calming inflammation, while thyme is good for dry coughs, especially if they're caused by throat irritation or muscle spasms. Ivy leaf extract. FDA category, not classified. Ivy pront and ivirospan syrup. Dose: 5 ml 2 to 3 times daily as per product label. Evidence: safe in moderate amounts. Avoid high doses due to potential gastrointestinal side effects. Thyme extract. FDA category, not classified. Bronchicum lozenges and thyme syrup. Dose: lozenge dose: 1 lozenge every 2 to 3 hours, up to 6 lozenges daily. Syrup dose: 5 ml 2 to 3 times daily as per product label. Evidence: safe in moderate amounts. May cause allergic reactions in sensitive individuals. Centrally acting antitussives. Dextromethorphan. FDA category C. Codiphen syrup, Tusselar 10 mg tablets. Dose: syrup, 5 ml every 4 hours, maximum 120 mg per day. Tablets: 10 mg every 4 to 6 hours, maximum 120 mg per day. Mode of action: suppresses the cough reflex in the brain. Evidence: supported by ACOG for short-term use when benefits outweigh risks. Liquid preparations of dextromethorphan containing ethanol should be avoided during pregnancy, as ethanol is a known teratogen. We have products that contain dextromethorphan, doxylamine succinate plus paracetamol, like Savendra syrup and Pentaflu syrup. 2. Second line, safe with caution. These medications have moderate safety evidence. Use these options only when first-line treatments are ineffective. Herbal remedies. Primula root extract. FDA category, not classified. Bronchicum and Nexi bronch syrup both contain primula root extract plus thyme extract. Dose: 5 ml 2 to 3 times daily as per product label. Mode of action: expectorant, mucolytic. Evidence: limited data, use cautiously. Ginger. FDA category, not classified. Dose: 1 to 2 gram per day as tea or added to food. Mode of action: anti-inflammatory, reduces irritation and cough reflex. Evidence: safe in moderate amounts. Centrally acting antitussives with mild action. Benzonatate, FDA Category C. Peripheral antitussive that works by numbing stretch receptors in the respiratory tract to reduce the cough reflex. It suppresses coughing, without affecting the central nervous system. Fulcodine. FDA Category, not classified. Copent syrup which contain fulcodine plus guaiacol which is expectorant and considered safe when used in small amounts. Caution is recommended particularly in the first trimester. Dose: 5 ml every 8 to 12 hours is needed. Mode of action: reduces the cough reflex. Evidence: use cautiously due to limited data. Noscapin. FDA Category, not classified. Tuscapin syrup. Dose: 5 ml every 8 hours is needed. Mode of action: mildly suppresses the cough reflex. Evidence: use cautiously due to insufficient safety data. 3. Third-line, limited safety data. Use these medications only when first-line and second-line treatments fail. Opioid antitussives. Codeine. Codepront syrup. FDA Category. Codeine is FDA Category C in early pregnancy, risk seen in animals, but benefits may justify use. And Category D in late pregnancy, evidence of fetal risk like respiratory depression or withdrawal near delivery. Use only if benefits outweigh risks. Dose: avoid in early pregnancy and near delivery. Use only as a last resort. Mode of action: strongly suppresses the cough reflex. Evidence: high risk of neonatal respiratory depression and dependence. Other antitussives. Levodopa. FDA Category, not classified. Tussistop syrup. Dose: the dose should not exceed 30 mg, 1 teaspoon or 5 ml up to 2 times daily to minimize potential risks. Mode of action: peripheral antitussive action. Evidence: limited safety data. Pypazethate. FDA Category, not classified. Selgin 20 mg. Dose: 10 to 20 mg every 12 hours. Mode of action: centrally acting cough suppressant with antihistamine and anticholinergic properties. Evidence: limited safety data, use cautiously. Clopirastine. Rastiglo 10 mg. FDA Category, not classified. Dose: 5 to 10 mg every 12 hours. Mode of action: depresses the cough reflex centrally. Evidence: limited safety data, use cautiously. The following medications are with varying availability and limited safety data in pregnancy. Not classified by the FDA: dropropizine, prinoxdiazine oxalamine, clobutinol and eprazonon. Dropropizine acts on receptors in the airways to reduce coughing without affecting the central nervous system. Prinoxdiazine, centrally and peripheral action acting cough suppressant with local anesthetic effects in the respiratory tract. Oxalamine, clobutinol, and eprazonon. Central antitussives act on the cough center in the brain. Other remedies with risks. Licorice root, IVC syrup, which contain licorice root, thyme leaf, and ivy leaf. FDA Category, not classified. Mode of action: anti-inflammatory. Evidence: avoid high doses due to risks of preterm labor and hypertension. Eucalyptus oil, alveolin syrup. Contain primula root, thyme and eucalyptus. FDA Category, not classified. Mode of action: relieves throat irritation, clears airways. Evidence: safe for topical use and steam inhalation, ingestion not recommended due to toxicity. 4. Contraindicated, avoid completely. Alcohol-containing syrups, risk of fetal alcohol syndrome. High-dose licorice root, risk of preterm labor and hypertension. Ingested eucalyptus oil, potential toxicity.